the moment I've had 3 treatments and I don't need to shave. I can get away with not shaving for 4 or 5 days, which is quite big for me, seeing as I've shaved my face every day since I was 11. My name's Katie and I've been having laser hair removal on my face. So I have Polycystic Ovarian Syndrome, so I have Hirsutism. I've struggled with Hirsutism since I was probably about 11 years old, and I have tried laser hair removal in the past, and I've had 2 unsuccessful treatments. So one was initially when I was 14 on the NHS, and then another one about 5 years ago, and I just didn't really see many results. And then I thought, okay, I'll give it one last try just to see if it will work.
And how is it working right now?
Brilliant. I used to have to shave my face every morning, and since I've had treatments, even within after the first treatment, the hair was massively reduced. I could get away with only shaving like my chin, and at the moment I've had 3 treatments and I don't need to shave. I can get away with not shaving for 4 or 5 days, which is quite big for me, seeing as I've shaved my face every day since I was 11. I just looked on the website and I noticed that they had treatment specifically aimed at people with PCOS, and I just saw a couple of videos on there, and saw a video with the woman who had she had quite thick hair. I had very coarse hair on my face. It was more like a like a proper man's beard. It was very coarse, very painful to remove, and I noticed she'd had good results, and I thought, well, kind of like a prime candidate, I guess, for laser, because I'm very pale and the hair's very dark. So I thought I'd just give it a go. I didn't have anything to lose. It could only be better than not shaving my face every day. The initial treatment was quite painful because I had very, very coarse hair, and it was from my neck until like here. So I did use numbing cream on my first session, but then since then I haven't used numbing cream because the hair that does grow back, I'm possibly only getting a few here and a couple on my chin. It's very fine, so it's not as painful as that initial first treatment, just because the hair was very black and coarse.
So you're doing so good, really good there.
Because of the hormones, it is something I'll need to constantly keep on top of, or the hair can grow back. So I'll probably need, once I've had my initial treatments, a top up maybe once every 6 months, once a year, just to ensure that the hair doesn't, grow back in the meantime. It's quite traumatic when you're a woman and you want to feel feminine, but you're kind of like growing hair on your face, which is overtly linked to being quite masculine. So yeah, I definitely recommend it for anyone who has PCOS, just because I think it's just made me feel so much more confident. I don't hide behind like the hair on my head anymore, because I've got long hair. I normally like put it forwards to like hide my face. I'd cake lots of makeup on, like colour correct, just so you can't see the 5 o'clock shadow growing. But yeah, I definitely would recommend it, especially for PCOS.
Perfect, thank you.
No worries.